I'm Sylvia Gordon. Rebecca is still out, still celebrating her birthday. Yeah, but I'm here at work trying to explain to you a really kind of dry and boring topic about Medicare Part B, as in boy, drugs, right? I'm going to do the hard, heavy lifting here. Medicare Part D, the Inflation Reduction Act, will cap Part D costs at $2,000. Not all drug costs, not Part B. They're not impacted. But Part B drugs that are infused in typically a doctor's office, a healthcare setting, are expensive, right? Think cancer drugs, think osteoporosis drugs, rheumatoid arthritis, expensive drugs. Part B drugs have a separate program, and that is if the drug company raises the prices faster than the rate of inflation quarterly, they have to rebate that back to the provider. Okay, so March 26th, CMS announced that 41 drugs were a culprit, so they had to reduce their prices. They got in trouble. It's quarterly, so they announced it in March. So in April, May, and June, those Part B drugs were reduced, and some were reduced because a Part B drug is capped at 20%. So some were reduced all the way down to you would pay 3%. I don't recognize this drug, but I'll put the chart here on the screen. And some are only reduced from 20% to 19.9%, but that you can see on the chart here, the chart is actually 3 pages because it's 41 drugs, but you can see there's a big swing. And if you were taking these expensive drugs, you can be like, wow, that was a lot cheaper that month. Now, if you're on a Medicare supplement Plan G or Plan N, you've already met your deductible for the year, you're not paying for your Part B drugs. If you're on original Medicare only, which I think there's something ridiculous, like 6 million people that are still in that position. A lot of them just didn't know, right? And then they couldn't afford the penalty, so they're stuck over there and they're paying 20%. They're going to notice that they got a discount for those 3 months. If you're on a Medicare Advantage plan, most Medicare Advantage plans, but not all, varies by plan, require that you pay 20% copay for Part B drugs. It's up to 20% copay because in this instance, if they were lowered for that quarter, that should flow back down to you. So if you're wondering why your bills look weird, that's some rare good news that I have. Again, it is readjusted quarterly and it's only for Part B drugs. Thanks for tuning in. If you don't follow us, if you don't subscribe to us, please consider so you can stay up to date on these ever-changing Medicare rules.
So I want you guys to watch this next video. It's from one of our top partners that has a fantastic Medicare lead program. So if you're currently writing Medicare and you really want to go to that next level, their system has worked for hundreds of agents across the country, and we're bringing it to you. Watch it, let us know your questions, and this might be your next big thing.
As an insurance advisor, you face many challenges getting access to the resources you need to be successful, especially if you're an independent advisor. Most advisors' needs will change as their business grows, and eventually, marketing will become your biggest hurdle to a 6-figure practice. Gordon marketing agents have access to a turnkey, proven marketing system that targets prospects approaching their initial Medicare enrollment. You can expect to be introduced to 20 to 30 new Medicare prospects a month with our program. All marketing and materials are done for you. All you need to do is show up and present to a room full of prospects. Our team creates each agent a company-branded presentation deck, marketing pieces, and a landing page that will reflect your company and branding. Each agent also gets a client-facing monthly newsletter to help support and grow their book of business. Lastly, and one of the best aspects of the program, is the ongoing coaching and mentoring sessions with successful agents in the program. If you think you're ready to start marketing for Medicare, but you don't know where to start, let us save you time and money with our proven marketing program.